Hi there, everybody. My name is Elliott Martin. I'm with Martin and Associates Insurance. We're an independent Medicare broker. We're located in Newport Beach, California, close to John Wayne Airport. We're right by that office there. Today, we're going to be going through a Medicare 101, a 2019 version. Pretty much everything you need to know about Medicare to give you a good start on what to look for, what the plan options are, penalties to avoid, and so forth. All that good stuff you're going to learn in this video. Okay, so here we go. We're going to get started. And today's agenda, what we're going to be covering, a little bit about myself, my background, just to get an idea of who I am and what we do. Then we're going to go through the 3 must-answer questions that you need to ask yourself if you're coming up on Medicare. Very important questions. Then after that, we'll go through your original Medicare benefits, your Part A and Part B of Medicare, which is also called straight Medicare, traditional Medicare, original Medicare, all the same thing. Then we're going to go into the 2 options you have from that point to take your Medicare benefits, really simplify it. Within each of those options, I'll show you there's tons of different plans available, but I just want to simplify it down into 2 different ways that you can go about taking your Medicare benefits. And then lastly, we will go through how you can get professional help with your Medicare at no additional cost. And that's for real, not joking around with that. So you can get help at no additional cost. Okay, so a little bit about myself. I was born and raised here in Irvine, California. That's actually a picture of an airplane flying into John Wayne Airport. I drive by on that freeway right there, the 405 freeway south, every day. And I'm sure a lot of you, if you're here in Orange County or LA, you're familiar with that scene right there. A lot of traffic. But yeah, born and raised here in Irvine, California. And I am actually the son of an insurance agent. That there is my dad, Ray Martin. He's the president of our company, Martin and Associates Insurance. He started getting into insurance, I think, late 80s. And he's been doing Medicare health insurance, just regular individual health insurance. He also handles retirement planning, investments, all sorts of things when it comes to protecting your health and also your wealth as well. So all sorts of retirement areas that we can help cover. Then a little bit more about myself. I went to Valparaiso University out in Indiana, and I got my business management degree, my bachelor's in business management, back in 2014. I played on the baseball team there, got a scholarship to play baseball, so that's how I ended up actually out in Valparaiso. My only scholarship, by the way, so had to take it, but enjoyed it a lot out there in Indiana. And then a little bit of a funny story here. That's actually my car out in Indiana. And while I was in college, I was actually studying to take my California insurance license. So I actually had to dig my car out of the snow and drive into Chicago to take my insurance license test. And I was able to pass that. And you'll see there, that's my insurance license number. Okay, I'm also AHIP certified, which that means it's a national certification that all insurance agents who are offering prescription drug coverage and Medicare Advantage plans must get certified by AHIP in order to take the contracting tests or contracting modules, they call them, for each company that we work with. And right now I'm contracted with about 9 different insurance companies. I've got about 10 to 12 different out-of-state licenses. And I've been with Martin and Associates. This is our Martin and Associates team since 2016, January 2016, and been doing insurance since 2014 or 15. Okay, and then here is my family. That is myself and Casey there. That's my wife. And we were at Rainier National Park. We love going to national parks. I think we've been to about 15 or 16 in the last 2 or 3 years. So we love going to national parks. And there's a picture of my family with her family. That's actually our wedding day. We had a small little wedding, or small little ceremony. We're going to have our big wedding this year in 2019. But we had a little ceremony. We got married first and going to be celebrating a bigger wedding this year. So that's our families together there. Okay, and so what exactly, now we're going to get into the meat and potatoes of today's presentation here, the Medicare 101. So what exactly is Medicare? So Medicare is the health or the federal health insurance program for people who are age 65 and older, people with certain disabilities. So a lot of times people will go on to Social Security disability. If you've been on to Social Security disability for over 24 months, you're automatically enrolled into Medicare. Also, people with end-stage renal disease, kidney failure, can also get Medicare early. Okay, so here's the first of the 3 must-answer questions to ask yourself is, do I qualify for Medicare? So you're going to qualify for Medicare if you've worked the 40 quarters and paid into Social Security and Medicare tax. I guess they call them credits now. They don't call them quarters anymore, but it's basically, quarters, your 10 years. If you are a non-working spouse, so let's say you stayed home, took care of the kids, you can actually qualify through your spouse if your spouse did pay into Medicare and Social Security. So you can qualify that way. If you're under 65, like I said before, you have to qualify for Social Security disability, and you must be on that for 24 months. In some cases, in more extreme disability situations, you can get that approved earlier. And then lastly, if you have end-stage renal disease, you might be able to qualify for Medicare. Okay, so those are all the types of people who can qualify for Medicare, and then you can finally trigger your Medicare at age 65. And do I need to enroll into Medicare? For most people, the answer is going to be yes, you need to enroll into Medicare when you're turning 65. Okay, you have a 7-month window, and that's called your initial enrollment period, and that goes the 3 months before your 65th birthday month, your 65th birthday month, and also the 3 months after your 65th birthday month. So that's the period of time that you have to enroll into Medicare when you're first turning 65. Unless, and that unless is if you have employer group coverage. If you're continuing to work or a spouse is continuing to work and you're covered on your spouse's employer plan, you may not necessarily need to enroll into Medicare at this time. You're going to want to verify 2 things. First, does that employer have 20 or more employees? And also, is your current prescription coverage considered credible? And by credible, what they mean is that your prescription coverage on your current insurance must be either as good or better than what you can find on Medicare. So if those 2 criteria are met, 20 or more employees plus credible coverage, then you can actually delay your Part B of Medicare, and you can just enroll into Part A at age 65. Okay, Part A, there's no cost, so it doesn't hurt to turn it on when you're first turning 65. Part B does have a cost. That's why you may want to delay Part B, is because really you'd be overinsured if you're continuing on employer insurance and you also have Part B of Medicare as well. Okay, so that's what you can do. One side note here, if you do have a health savings account, definitely make sure that you have credible coverage. A lot of times those health savings accounts, because they're tied to high deductible health plans, it may not be considered credible coverage. But if it is credible coverage, then delay both Part A and Part B. Okay, did you hear that? Delay both Part A and Part B if you have a health savings account with credible coverage and you plan on contributing to that health savings account. Then you cannot enroll into any parts of Medicare without tax penalties or tax consequences. So just be careful about that. And then what you want to do is you want to stop contributions to your health savings account 6 months before you need your Medicare to start. Okay, so that is the health savings account. Do I need to enroll into Medicare? Yes, unless you have employer coverage with those criteria met. Question 3, if you do need to enroll into Medicare, how do I enroll into Medicare? Okay, if you're turning 65, you can either go online to ssa.gov/retire, or you can call the Social Security office, which a lot of times can be a really long wait time on the phone. That phone number is 800-772-1213, or you can walk into a local Social Security office as well. Okay, so those there are the 3 must-answer questions. Now we're going to get into your original Medicare benefits. These are also known as traditional Medicare benefits or straight Medicare. That's your red, white, and blue card there. That's the new Medicare card. And what you'll notice is that they no longer are using your Social Security numbers on the Medicare cards. They finally figured that it's a bad idea to be putting Social Security numbers on your Medicare card. So now they've replaced it with what's called a Medicare beneficiary identifier. It's kind of a combination of letters and numbers to come up with your new Medicare number. Okay, and that so how Medicare works. Medicare Part A and Part B make up original Medicare. So those are your 2 parts of original traditional Medicare, and Medicare is called a fee-for-service system. So that means that doctors and specialists and hospitals all around the nation who contract with Medicare must agree to a Medicare fee schedule, different services that they can provide and what they'll be compensated for those services. Okay, so there's already a predetermined list of services and fees that the providers can charge for their services. So we'll get into Part A. Part A is going to cover you for hospitalizations and also skilled nursing, and that's inpatient hospitalizations and skilled nursing. Okay, and Part A has zero premium to it as long as you've paid into Medicare and Social Security for those 40 quarters. There's no additional cost for Part A of Medicare. And let me just take a step back here. So the good part about Part A is that Part A allows you to actually go use any hospital and any skilled nursing facility anywhere in the United States as long as they're contracted with Medicare. So that's the great news. It's tremendous freedom of choice with Part A of Medicare. However, Medicare is not going to pay for everything. That's the bad side, is Medicare doesn't pay for everything. So there is a $1,364 deductible for any inpatient hospitalizations for days 1 through 60. After that, Medicare pays for everything else within that first 60 days. Then, if somebody stays over 60 days, between 61 and 90 days, there's then a $341 a day copayment. So now it's getting a little bit more expensive. Then, if somebody stays over 90 days, not going to happen often, but if somebody were to, they then have a $682 a day copayment. I'm sure a lot of you would rather be staying at the Marriott or the Ritz-Carlton down by the beach for that price, right? $682 a day. So Medicare, great start. It gives you tremendous freedom of choice, and there's one other out-of-pocket I forgot to mention. Skilled nursing does have an $170.50 a day copay for days 21 through 100 in a skilled nursing facility. So the idea behind Medicare, original Medicare, is that it gives you tremendous freedom of choice, but obviously it comes up short with some of those out-of-pocket costs. Okay, then we get over to Part B of Medicare. Part B is going to be all your outpatient medical services, and Part B does have a cost to it. Part B starts at $135.50 a month, and if you're collecting a Social Security check already, Medicare will automatically deduct that from your Social Security check. If you aren't collecting a Social Security check yet, Medicare sends you a quarterly bill for that Part B premium. So it'll be about a little over $400 every 3 months for your Part B premiums. And you'll see I do put in parentheses it's means tested. So what that means is that they're basing your Part B premiums off of your income. So they use a chart to determine what you actually pay for Part B. And here's that Part B monthly premium chart. So you'll see here, depending on how you file your taxes as an individual or a joint or filed married in separate tax returns, this is what you're going to look at. And Medicare always looks back 2 years. So this year they're looking back to tax year 2017. And you'll see here if you're an individual tax return filer and you're below $85,000, or if you file a joint and you're below $170,000, then you're paying $135.50 a month for your Part B premiums. But as you can see, if you've earned higher incomes for you and your spouse in some cases, or just by yourself, you're going to be paying a higher Part B premium. It tops out at $460.50 a month if a joint, a couple is earning $750,000 or more back in 2017. So that's how they do base your Part B premiums. If you are in a higher income bracket after you enroll into Medicare, they're going to send you letters talking about IRMA, which stands for Income Related Monthly Adjustment Amount, and explaining pretty much all the extra that you're going to owe. So that's the Part B premium. Okay, most people are going to be paying $135.50 a month. And this is going to cover you for your doctor's visits, specialist visits, any x-rays, lab tests, diagnostic tests, any outpatient surgeries, chemotherapy, radiation, ambulance trips, other things like physical therapy, and let's see, what am I missing? Preventative services, things like that, tests, are all covered under Part B of Medicare. And same thing as Part A, Part B allows you to go see any doctor, any specialist, anywhere in the U.S. as long as they're contracted with Medicare. I think the stat right now is about 92 or 93% of primary care doctors in the U.S. take original Medicare. Okay, so it's tremendous freedom of choice. Once again, you don't need any referrals. There's no network restrictions. You don't need permission to go see doctors or get a second opinion. So tremendous freedom of choice. That's the good news. But once again, if you're not aware of it, Part B does have out-of-pocket costs. So there is an $185 deductible, and that's for the year, just once for the year. And then after that, what happens is Medicare pays 80%, and you'd be responsible for 20% of any of those outpatient services. So not a big deal if you're just going to the doctors once or twice a year, but if you can imagine anything like an outpatient surgery or chemotherapy, that is a large percent to be responsible for. Plus, there's no cap to that 20%. It just keeps going and going as long as you're using those services. So some major out-of-pocket costs. Okay, so that there is your original Medicare benefits. What you get from that tax you've been paying your entire working career is you get Part A and Part B of Medicare. It's a great start, tremendous freedom of choice, but obviously some major out-of-pocket costs that we want to make sure that you don't have to pay for. Okay, so now we're going to get into your two different options that you have from that point. So that there is the base. Option 1, you can choose to add on what is called Medicare Supplement insurance, also known as Medigap insurance. So this is where private insurance companies come in. A lot of the companies that you've heard of, they offer these Medicare Supplement plans. And they alphabetize the plans A through N. Make it nice and confusing for you, right? You have parts A, B, C, and D. Then you have plans A all the way through N. The most popular plan this year in 2019 is going to be the Plan F. And the reason why the Plan F Medicare Supplement plan is so popular, and one side note, the plans, I don't know if I mentioned, they're standardized, so that means that a Plan F from one company is going to have identical coverage to a Plan F with every other company. So they are standardized plan. A Plan F is a Plan F is a Plan F. And why the Plan F is so popular, what it does, it pays for that 20% responsibility, and I'm going to use these check marks, pays for that 20% responsibility for Part B services. It also pays for the Part B deductible, the $185 for the year. So now between your red, white, and blue Medicare card plus a Plan F Medicare Supplement, you have no deductibles to meet for Part B services, and you have no co-insurance. So now you have 100% coverage. Also, the Plan F pays for that Part A deductible of $1,364. So days 1 through 60, you have no deductible to meet. Then days 61 through 90, that daily copayment the Plan F pays for. Days 91 plus, $682 a day. You do not have to pay for. The Plan F will pay for that. And then, if you haven't figured it out yet, also skilled nursing. Skilled nursing for 100 days will be covered between Medicare and your Plan F, 100% first dollar coverage. Okay, between original Medicare, your red, white, and blue card, and a Plan F, for any services that are covered by Part A or Part B, you should have no deductibles to meet, no co-payments, and no co-insurance. 100% first dollar coverage. That is pretty great. And on top of that, you have the freedom of choice to go nationwide to any doctor, any specialist, use any hospital, anywhere in the U.S. that is contracted with Medicare. Okay, so that's great. But what does this Plan F cost me? What is it going to cost people here in Orange County at age 65? A Plan F is going to run about $150 a month. It's about an average cost. These plans do go up each year with age, maybe $7 to $10 a year. They're going to go up and increase in premiums with age. Nothing drastic like we've seen on a lot of covered California plans or Obamacare plans with 25-30% increases. The Medicare plan, Medicare Supplement plans, usually a 3 to 5% increase per year. Okay, so that there is the price for a Medicare Supplement Plan F right now here in Orange County at age 65. And the last thing we would need to do for this option here is add on Part D. Part D is the prescription coverage. Those plans, I'd say for our clients, it's about a $30 monthly average premium for Part D plans. And I'm going to go into explaining a little bit more about these Part D plans in a minute. Here's what would be your total cost is about $316 a month. You have your Part B premiums, which are $135 a month, $135.50. We add on a Plan F Medicare Supplement for about $150, and then prescription coverage, we're looking on average about $30 a month. So that would be your complete package there for option 1. And now I'd just like to explain a little bit more about Part D, the standalone prescription drug plans under Part D. This is kind of an overwhelming chart, I know, but let's just simplify it. Let's start down at the bottom. In the yellow box down at the bottom, you'll see it's the deductible period. So these prescription plans have 4 stages to them. The first is the deductible stage. A lot of plans do have a $415 deductible on it. Some may have a $365 deductible, $365. Some have no deductible on it. Okay, but if your plan has a deductible on it, you're going to be paying that first $415. In some cases, generics at a preferred pharmacy, you may pay nothing, even if your deductible hasn't been met. But other prescriptions and brand names, you might be paying the full cost up to that $415. Once your deductible's been met, you're then going to go into the orange section there, the initial coverage stage, and you'll see on the right-hand side as the enrollee, you're going to be paying about 25% for the costs of your prescription. You stay in that initial coverage stage until your total cost of your prescriptions reaches $3,820. That's a combination of what you have paid as the enrollee plus what the plan has paid. If you do hit that $3,820 mark, you then go into the blue section, which is the donut hole, also known as the coverage gap. And you can see your percent on the right-hand side in the blue box. Your percent coinsurance is 37%. Cost of generics, your brand name, stay at 25%. So you can see your costs may be going up during the donut hole. And Medicare will be getting rid of the donut hole by 2020. Right now, as it stands, it's going to be gone completely. So you're going to be paying pretty much 25% until you get into the 4th stage, which is the catastrophic coverage there in the green. And you can see at the top as the enrollee, you're going to be paying about 5%. So here you get a break. And you'd hit this if your annual out-of-pocket threshold reaches $5,100. That's a combination of what you've paid plus what any drug manufacturer discounts that you have received reaches that $5,100 mark. You go into that catastrophic coverage stage, and you're only paying about 5%, or $8.50 for brand names, $3.40 for generics. Whichever of those two amounts is higher, you'll pay. So that there is just a quick explanation of Part D coverage. And this applies to all Part D plans on Medicare for this year. Okay, so now we're going to get into your other options. So first we described that option 1, you stay on original Medicare. That gives you the freedom of choice, nationwide access to any provider that's contracted with Medicare. We add on a Plan F, Medicare Supplement, or any other supplemental plan. And then we add on Part D of Medicare, prescription coverage. The other option here, option 2, this is called Medicare Advantage. And here in Orange County, it's mostly going to be HMO plans in Los Angeles, Riverside, San Bernardino counties. They're mostly HMO plans. There may be a couple PPO plans that are considered Medicare Advantage. But if you're looking for PPO, we suggest option 1. Okay, but these HMO plans, the really attractive thing about them, there's 0 additional monthly premium. You still have to pay your Part B premiums, which is the $135.50 a month, but there's no additional cost to get enrolled into a Medicare Advantage plan for most of the plans here in Orange County this year. But with HMO, obviously we know that we need to pick a primary care doctor, and then to go see specialists, you're going to need referrals. We also need to select a medical group for you to belong to. So you have to stay within your medical group. You can only get referrals within your medical group of doctors that you've selected. So it's going to be much more restrictive than it is on original Medicare. We have to kind of narrow down what group of doctors you want to belong to. And one side note about the zero premium part of the plans, you may be wondering, how are these plans able to offer this for zero premium? Well, every Medicare recipient that enrolls into a Medicare Advantage plan, those companies get about $1,000 a month per person who's enrolled in their plan. They get a check from the federal government, about $1,000 a month. So that's about $12,000 over the year. For a couple, $24,000 these companies are getting paid for, or getting paid to take on the responsibility of your health care. So that's how they're in turn able to offer it for zero premium at the moment. With the Medicare Advantage plans, we still will have co-payments. So as you're using services, you still pay out of pocket. And each company has determined their own set of summary of benefits that lists what you pay for different services. So in this option 2, you no longer belong to those original Medicare A and B out-of-pocket costs that I described earlier. This is a completely different set of summary of benefits that you'll get and that you can find with each Medicare Advantage plan. It's going to be different from plan to plan. The good thing about these plans, and right now here in Orange County, they have what are called max out-of-pockets built in, and the max out-of-pockets right now are pretty low. It's between $1,000 to $2,000 for most plans. So that means if your copays do add up to reach that $1,000 or $2,000 threshold, the plan pays for everything else for the rest of the year. And then January 1st, you start over paying copays. And the last part of these Part C plans, Medicare Advantage, is the prescription coverage is included. Part D is included on a lot of the plans. So you don't have to go and get a separate Part D plan. It's already built into your Medicare Advantage plan. Okay, so that there is option 2 for you. So those are really the 2 different ways that you can take your Medicare benefits. Option 1 I described, it's much more freedom of choice, nationwide access to doctors and specialists and hospitals. We eliminate your out-of-pocket costs with the Plan F Medicare Supplement, and we add prescription coverage. Option 2, it's going to be lower premium monthly. It's zero additional premium for most of the plans, although it's going to be more restrictive as far as what doctors you'll have access to, and you'll have to get referrals to go see specialists, so it's a little bit more restrictive type of plan. But some people are familiar with a set of doctors that they go to and don't really see themselves going outside of that network of doctors. Perfectly fine. Medicare Advantage works great. The benefits are great. A lot of times it's zero copay to go see your doctor, zero to go see a specialist for the really good plans here in Orange County, and hospitalization, no copay, outpatient surgery, zero copay. But as you're using different services, maybe an x-ray or an ambulance trip, you're going to have copays for those types of plans. Within each option, there's obviously a ton of different plans available, so that's where we would need to dig a little bit deeper with you if you wanted to work with us one-on-one. We'd have to go, in option 1 or option 2, but really that's the basics there of how you're thinking about taking your Medicare benefits, either option 1 or option 2 there. Okay, so how can you get professional help? Well, 1, you can contact us, Martin & Associates Insurance. We're an independent Medicare broker, and so we can help you shop for plans, research prescription coverage, help you shop for Medicare Supplement insurance, all that good stuff. You can call us at 800-464-4941. If you'd like to book an appointment with us to get together, you can go to martinmedicare.com and you can schedule either an in-person appointment with us or a phone consultation with us. Okay, if you're not in the Southern California area, we do have our out-of-state licenses, about 10 to 12 out-of-state licenses, but if you just want to Google search an independent Medicare agent or broker, just Google that and then add your city, and hopefully some good agents will pop up in your search results. And you can call a couple and see if it sounds like they know what they're talking about and go use an independent agent in your local area. And then the importance to using an agent or why it's so beneficial is there's no additional cost to use a broker or an agent. We get paid by the insurance companies. So as we sign our clients up for different plans, the companies pay us. So there's no additional cost. You could go straight to the insurance companies and work direct to the companies and you pay the exact same premiums. So we think having somebody who's able to offer all the different sets of plans, that's more beneficial to you. We can help switch plans in the future. We'll help service your policy. And each time you call us, you're getting the same person, right? When you call the companies, you're going to get a different person on the line every time. So that's the advantage of using a insurance broker or agent. And then lastly, since you're watching this video probably on our YouTube, please subscribe to our YouTube channel. We post educational videos with everything having to do with Medicare here. So please subscribe if you like this video. Give me the like button. Go ahead and hit that like button. And thank you everybody for watching. Please contact us if you have any questions. You can leave questions down below in the comment section, or feel free to contact us with any further questions. So thank you everybody for watching. We will see you next time.